Hi everybody, welcome to this class. So in this class, we'll be discussing about medico-legal autopsy. So there are various important questions in this part which will be coming in your exams. Let's dive into the subject and let's study the important questions. Okay. Now coming to what are the important questions, there are so many shorts that can come from this topic. The important ones are the types of autopsy, what are the objectives, the rules of the medico-legal autopsy. You need to know about the types of skin incisions. You need to know about the methods of dissection of organs. So there are different methods that are used for dissection of organs. Okay? So this one not only comes for your exams, it can also come as MCQs. Okay, you need to know what are the different techniques: virtual autopsy and psychological autopsy, viscera preservation, techniques for examination of heart at autopsy, procedures of removal of brain at autopsy, and exhumation. So in the textbook, when you see, there I have given about autopsy of each and every organ. Okay, you need to know these two organs in brief. Like heart and brain are the ones which are really, really important and have been asked so many number of times. So you need to be thorough about these two topics. Now, coming to why choose Auricle? Auricle is a platform which has recorded classes, live classes. We also have practical sessions, exam module, and hard copy book set. So all these different things are available at a single platform, which will really help you ace your exams. And you can use the app with all these features to study wherever you're comfortable at. Okay, so that is one of the plus point that comes with the app. Now, coming to the recorded classes. So, recorded classes, the main aim of recorded classes is that it is going to offer you a flexible learning experience. What do you mean by flexible learning experience? That is, you can watch these videos anywhere, anytime. Whenever you're free, you can just open a video and you can study. And all the instructors that are there here, the educators, they have very good hold on the subject and they're going to cover each and every topic, no matter how small or large the topic is, ensuring that you're taken care of through the subject. Okay. So I'll be doing the same for the subject of forensic medicine and toxicology. I'll be explaining to you everything, even the simplest of the simplest things to be explained in the recorded classes. And these platform with recorded classes is also convenient for you to revise because whenever you feel like you have lost touch about a particular topic, you can go back to the video and watch it. Therefore, it is going to act as a convenient revising tool wherever you're comfortable. Okay? Now, coming to the live classes, what does the live classes have to offer you? It gives in-depth coverage of all the topics. The experienced educators will give you extra insights on how you have to develop your answer writing skills, how you need to develop study plans, and therefore you can effectively study a subject. Past 10-year PYQs are given much importance because these are the questions which are anticipated in the coming exam also. So if you do not have enough time and if you want to do that last moment revision, then you should always aim at the past 10-year PYQ questions. And here in live classes and exam module, we are going to cover exactly this so that you have an extra edge over the subject and on all the friends. And these are going to be interactive sessions where doubt clearance will be there, MCQ polls are going to be there, Viva voting is going to be there. So because all these are there, children are engaged in a good way so that they find the classes interesting. We also have express exam module. So in the express exam module, it is going to cover the entire syllabus in less than 20 hours. So when the syllabus is covered in less than 20 hours, you have a comprehensive and effective coverage of the syllabus, and you also know what is going to be important and what will come in your exam. It is also going to tell you about the answer writing skills. So a lot of students know a lot about the topic, okay, but they do not know how to answer in the exam. That is where they lose their marks. But here, your educators are going to tell you what diagrams to put, what flowcharts to include, and how you need to effectively write answers so that you get that extra marks. Okay, and these educators will also guide you through and through throughout your preparation. They'll be there to clear all your doubts. So there is also one-to-one doubt clearing session. So in one-to-one doubt clearing session, there is a student-centric approach that is taken. So every question, however small or big, is valued and it is addressed by the dedicated educators. And also because it's one-to-one, no? So there is going to be personalized attention given to each and every student. So what happens when there's personalized attention? Every doubt, no matter how big or small, is cleared, and each person's doubt is different, no? And each person needs a specific kind of attention. So that is also taken care of here. There is also safe learning environment where all the queries are answered and you do not have to be fearful about judgment. So what happens in normal theory classes, a lot of students have this fear of being judged by their peers if they ask a question. So nobody asks questions, okay? So So here in this platform, you have this environment where you can safely ask questions and get everything clear. And this platform is going to be very supportive and understanding towards all your questions and you. It also provides you with hard copy note set. This hard copy note set has in-depth coverage of all the topics. There are a lot of flowcharts and also flashcards. You can use all of these, and these are there in a colorful format. So what happens when all of these are there in a colorful format? It is easier for you to grasp everything, and you develop that pictures to memory. So to develop that pictures to memory, whenever you have this pictures to memory, it is easier for you to retain things at a glance. And the notes of Oracle will help you exactly in this. Now coming to the question bank, so the question bank has three level of questions. Okay, so there is beginner to expert level. So beginner level are the very easy questions, and then as you go by at the end, you have the expert level of questions, and you can select whichever module you have to solve, and it is a customizable thing. So if you're studying a particular topic, you can go back and choose questions from the particular topic and answer them. And the questions cover every exam, like maybe your prof exams, NEET, PG, FMT, everything is taken care in this Cube bank. Now, coming to the practical sessions, actually, what happens is that usually practicals happen in the college, no? But there is a specific time delay between when practical happens in the college as well as when you are going to give your exam. So, in that time delay, what happens? Usually, children tend to forget. So, in order to combat that, Oracle has given you practical sessions in which you have hands-on experience about various things which simulate the real case scenarios. There is expert guidance regarding practicals. There is also fair insight given about Viva OC, spotters are discussed. So you're taken care through and through, and this covers that bridge that is there between when practicals happen in your college and when you be giving practical exams. So this is one of the need of the hour. Okay. And then also coming to the different subscription plans that are there, we have the foundation plan, advanced learning plan, complete learning plan, as well as ultimate MBBS plan. In the foundation plan, it is for 3 months and it has pre-recorded classes, live classes, express exam module, practical sessions, and Q1. So all these five things are there in the foundation plan. Now coming to the advanced learning plan, you have the same five things and here it is for a period of 6 months. Okay. Next, you have the complete learning plan where apart from the five things that I mentioned, you also have hard copy notes set as well as one-to-one doubt clearing session. Okay. Next, you have the ultimate MBBS plan. As the name suggests, it's ultimate. So what do you understand by ultimate? You have all these things, and here, because it's ultimate, it is there for the period of 4 years. So when it is there for 4 years, what happens? You're through and through covered throughout your MBBS. Okay. Now you can use the code Dr. Prashi Kaveri 20 to get additional discount whenever you subscribe to Auricle. Okay. Now, coming to the topic per se, we'll be discussing questions from the topic medico-legal autopsy. This will be a small class, and because there are only some important shots that are asked for exam from this topic. Okay? Firstly, we need to understand what are the different types of autopsy, what are the objectives, and the rules of medico-legal autopsy. Now, coming to the types of autopsy. So, autopsy is basically you cut open the body and you try to find out what is the cause of death. So, there are certain types of autopsy. So, what are the types of autopsy? We have clinical or pathological autopsy. Then we have medical legal autopsy, and then we have anatomical or academic autopsy. Now, coming to clinical or pathological autopsy, it is used to determine the disease causing death or to confirm the clinical diagnosis of death done with consent of next of kin. So, basically, whenever there is a medical legal case, MLC, and the person has died, and you suspect that there is some foul play in causation of the person's death. That is when a magistrate or from the police you get an intimation saying that autopsy has to be done in order to find out the cause of death. That is nothing but the clinical or the pathological autopsy. And here the relative's permission is necessary. Okay. And the medical legal autopsy is the same whenever there is any suspicion about the death, that is, any foul play is suspected, then you do the medical legal autopsy. Coming to the academic autopsy, as the name suggests, academic. This is something that is having to do with studies. So, what do you understand by medical legal autopsy? That is, it is done in order to learn the normal structure of the human body by medical students. So, basically, after you join your anatomy, after you join your first year of medicine, you go to your college and then you have this dissection every day where you go, you cut open the body. Why do you do that? In order to become familiar with the different organs, blood vessels, and all that is there. No? So, this is nothing but anatomical or academic autopsy. Now, coming to the objectives of autopsy. So, whenever we talk about autopsy, there are certain objectives. So, number one objective is nothing but to find out the cause of death. This is the ultimate purpose of autopsy. You need to cut open the body. You need to identify if there is a peculiar smell, if there are any injury marks, if there are any wounds that are there, if there is any bullet that is there, corrosive attack. Like basically, try to dig in and find out about all these in order to finally understand what was the cause of death. You can also find out time since death. So there are various things like rigor mortis, and then there is also livor mortis. Livor mortis is the coloring, the pigmentation, the viscous or the hypostasis that occurs, and then you have all these changes. Then late changes are something called as putrefaction. So all these occur as time passes after the person dies, and all these develop after a certain amount of time. Okay, basically they all most of these start after like 12 hours, and then they become prominent after like 24 hours, and then they try to decrease. So based on this, you can estimate the time since death. You can also find out the manner of death. For example, if there is an injury, electrical injury, and then there is a long perforation, you can think that maybe the person was stabbed by a knife. Or if there is a entry wound of a bullet where there is singeing, blackening present, you might think that it is a firearm injury. It also helps to establish identity when not known, because during autopsy you can look for any tattoo marks, you can take the fingerprint of the person, you can do blood testing. So when you do all these, you can even understand the identity of the person. Okay? You can also collect physical evidence. So how do you collect physical evidence whenever you're trying to find the cause of death? It is nothing but you try to collect various things. Like for example, the vomiters of the person. For example, food content in the bowel. So you take all these. So these act as a physical evidence in order to identify a criminal. You can also take parts of the stomach, intestine, kidney, blood, urine. So you can do various chemical examination on all these, and you can try to find out what is the cause of death. Got it? So these are the objectives of the autopsy. Now, coming to the rules of medical legal autopsy. Rules of medical autopsy, it should be conducted in a mortuary. What is mortuary? Mortuary is a place where the dead bodies are stored. So you can do it only in these places where dead bodies are stored. Simply because even if you want to do autopsy, you can't just go to the hospital and do somewhere in ICU or in the ward. Okay, you have to do it in the mortuary, and it should be conducted only when there is an official order from the police or magistrate. Remember this point. Just because somebody has died and the doctor feels like there might be a foul play, he can't tell his fellow doctor to do an autopsy, or he by himself cannot do autopsy. He has to have an order from police or magistrate in order to carry out autopsy. It is conducted as soon as possible without delay, because as long as there is delay, no, there are certain changes that can be missed from the body. Okay, and also the kit and kin of the person will want to do the cremation process, no? So even that will get delayed. So in all, considering all this humanitarian things as well as the bodily changes that take place, we have to conduct an autopsy as soon as a letter is given to us. Okay? And the examination should be conducted in daylight, because there are certain color changes in the body. Okay, for example, as we discussed, there is livor mortis that is seen. Livor mortis is nothing but post-mortem staining. Similarly, there are so many other color changes, like for example, there could be poisoning by carbon monoxide, which gives a cherry red color. Such things are identified thoroughly only when it is examined under a bright light. That's why we should always conduct autopsy in a bright light. Okay, so these are the rules of medical legal autopsy. Apart from this, there are some other rules. So, what are the other rules? Body should be identified by the person who is stating that they need an autopsy. So, this person has to identify the body before the doctor makes the incision on the body. No unauthorized person should be present. That is, any unauthorized person, for example, a kith and kin, a relative of the person, or some other police officer, or some other doctor, or some other neighbor of the deceased. Nobody should be present. Only authorized, the doctor and the police, the authorized people only can be present. Details of examination should be noted, sketches made of all the important injuries. So, in a paper, in a blank paper, what does the doctor do? The doctor, roughly documents, puts a diagram as how a person is looking dead, and then wherever injuries are there, no, for example, he draws one image, and after that, whenever there is image, so for example, there is image in the this is the right side of the person, this is the left side of the person, and imagine there is an injury in the right side of the person in the chest region. So he puts in an arrow, he puts in a cross or something there, and mentions in the side stating that a contusion or a ecchymosis or a bruise, whatever is present in so and so parts. So for every injury, such thing is noted. And for example, imagine he had a fracture left side in the femur. So he puts in an arrow and writes there is a fracture in such and such bone. So this is the documentation, the sketch that the doctor makes. And the autopsy should always be complete. Every organ must be examined. After completion, the body is handed to the police. So you cannot just open the body and after examining heart or spinal cord, you cannot be like the autopsy is over. Okay, you have to be very vigilant. You have to examine each and every part of the body, and then you have to make the report. And after that, the body at the end is handed over to the police constable. Got it? Now, coming to what are the types of skin incisions. Now you know what is autopsy, you know what are the rules and what are the objectives. No? Now let's understand what are the types of skin incision. Okay, so if you look at this image, you can see that the first one is looking nothing like an eye. It is a straight line. No, therefore it is called as eye-shaped incision. So how does eye-shaped incision look like? It extends from the chin region. It goes as a straight line, and near the umbilicus, a right or a left turn is taken, and then it goes up to the pubic symphysis. So this is how an eye-shaped incision looks like. How does it look like? Starts from a chin, straight line in the center of thorax, center of abdomen, goes up till the umbilicus, takes a turn, either a right or left, mostly it is the right turn, goes up to the pubic symphysis. Next, we have the Y-shaped incision. How does a Y-shaped incision occur? So it starts from the acromion process. Okay. So here, whatever I'm pointing with this red color arrow, no, this is nothing but the acromion process from which the incision starts. So from the acromion process, the incision starts. It goes below the nipple, it goes till the center, and then it goes as straight line, like however eye incision happens, it goes like that, and then it takes a turn around the umbilicus and goes up to the pubic symphysis. Here, as the name says, it's Y, no, because the shape of the incision finally looks like a Y. Where does it start from? It starts from the acromion process. Next, we have the U-shaped incision. So, how does a U-shaped incision looks like? See, if you see the picture here near the neck, no, it starts from the neck, and then because it starts from the neck and then it goes, the remaining course is same as the I-shaped incision. Center of the thorax, center of abdomen, turn around the umbilicus, and up to the pubic symphysis. Near the neck, because of final incision, the initial part looks like a U, it is called as U-shaped incision. So these are the three incisions that you need to know. So what are the three incisions? You have the I-shaped incision, you have the Y-shaped incision, and then you have the U-shaped incision. Okay. Now, coming to the methods of dissection of organs. So there are different methods. Initially only, this is a very important MCQ topic that you have to know. Okay. And recently, 2 years back in NEET, I think it was 2022 NEET. Okay, there were two questions that were asked from the same topic. One was about bird shows, and one was about lectures, and one was about rocket dance. Okay, so just understand what is the importance of this topic. Okay, so this is a direct question. So when they ask you, even in your Viva OC, they can ask you. They can just be like, if the organ is removed one by one, that is, you remove heart, you remove kidney, you remove intestine, one by one, if it is removed, what kind of dissection is it? It is nothing but it is virtuous. So you have to know, it should be there in the tip of your tongue, which is for what? Next, we have Rokitansky. What is Rokitansky? It is done for in situ dissection. What do you understand by in situ dissection? That is, as we saw initially, you make the incision. Basically, a I-shaped incision is made. You reflect the skin and the muscle. After which, everything is done inside only. You do everything inside, in situ. So when do you do it? So usually everything is taken out. So you might ask, ma'am, why are you doing it inside? It is because whenever there is a person who suspected of HIV or any other communicable or contaminated body, then you can't cut open. No? The doctor who is doing the dissection might get infected. In such cases, we do Rokitansky dissection. Remember, HIV is one of the important examples for it. Coming to the legumes, here cervical, thoracic, abdominal, and the pelvic organs are removed en masse. So, what do you understand by this? That is the cervical. Here, the neck structures, takes the thorax, the heart, the pericardium, pleura, everything, abdomen, the stomach, intestine, everything, pelvic, everything is removed en masse. That is, they are removed together. So, as a single block from top to below, you remove everything as a whole, as a single block en masse together. That is meant by legumes. Now, how do you remember this? Lettuce. What is lettuce? No, it belongs to Brassicaea family. No, it is nothing. So lettuce, how there are so many things and everything together forms one lettuce. No, so many leaves. So remember that in lettuce, en masse, everything together. Got it? Coming to Gons technique. What do you understand by Gons technique? Cervical, thoracic, abdominal, pelvic organs removed as organ block. That is, for example, cervical is removed as one block. So what do you understand by this? That is the neck structures, the thyroid, hyoid, everything is removed as one block. Next, after that is done. Next, you go to the thoracic block. Here, the pleura, pericardium, everything is removed by another block. This is nothing but Gon's stick. One by one. Each block is removed. Okay. Coming to the next question, it is about virtual autopsy and psychological autopsy. So, what do you understand by virtual autopsy? Virtual autopsy is also called as autopsy. So, virtual, what do you understand by virtual? Virtual means something that is not real. In your science and all, no, in your high school, you have studied no virtual image, real image. No? So, what is virtual? Virtual means something that is not real. So, autopsy means cutting open. No? You might ask me, ma'am, what is it? What cannot be real in autopsy? So, virtual autopsy means you're not actually cutting the body. When you cut the body, it becomes autopsy. Here also, you're trying to find out the cause of death, but you're not cutting the body. So, it is a non-invasive using imaging techniques like CT, MRI. So, you use scanning, like CT can be used, MRI can be used, and you try to find out what caused death. And traditionally, what people would do, they cut open the body. No? You're not cutting open the body. Just by using a CT or MRI, you're trying to find out what is the cause of death. So this gives you it tells you about what is the cause of death. Also, it gives you evidence, physical evidence that can be preserved. What do you understand by physical evidence? It is nothing but all the scans, no, whatever you have in the computerized data that can be preserved and can be used in the future date. It also gives you detailed visualization. It provides high resolution images of the internal structures, helping to identify injuries, structures, and the foreign objects. So whenever you do a dissection normally, whenever you do an autopsy, there could be some fractures of foreign objects that could be missed. But whenever you do a autopsy, because you're using CT and MRI to see the entire body, to scan from the head to toe, you're going to find out anything that could be easily missed. You can find out about all the injuries, fractures, foreign objects. So you can find out about all of these. Got it? And also it helps you in documentation and record keeping. So how it helps in documentation? The imaging results serve as a permanent digital record, aiding in legal proceedings and providing clear documentation. That is, as I told you, whenever you do the scans, no, CT or MRI, you have the images that come out, and these images, nothing, it is all computerized. So you have this data in the computer, you can preserve it, and you can use this data for later whenever you go to give evidence or whenever you have to get back the images to find what was the cause of death, or if there was any discrepancy, you can use this data. It is going to be a permanent digital documentation. It also acts as a complementary tool. Virtual autopsy can enhance traditional autopsy methods, offering a second perspective and helping to clarify complex cases. That is, imagine you have done an autopsy and you feel like so and so is the cause of death. But later, when you do a virtual autopsy, you might find some other things that could aid in helping you find a cause of death. It will give you a broader and a deeper perspective in order to solve the case. So these are the uses of virtual autopsy. It also has broader applications. That is, whenever you're doing a mass disaster investigation or you're studying about a historical study and to analyze remains of physical remains without physical disturbance. So, a lot of cases, what happens whenever you do an autopsy, you make cuts. So, a lot of family members will not want their kitten king to undergo. They want their kitten king to be buried as it is. Okay, they do not want you to chop off the body and find out what is the cause of death. Then when you do virtual autopsy, it is a scarlet thing. You're not cutting open anything. You're just scanning the body. So that is how it can be helpful in finding cause of death in such cases where family members are not supported. Okay? Next, it also, whenever there are a lot of people who are dead, whenever there is a mass disaster or something, then what happens? Manpower is a constraint. That is, each autopsy takes a lot of time. Okay? Even in such cases, you can make the body go through MRI or CT. You can do a virtual autopsy so that you can do it faster. You can find the cause of death faster in your future. So these are the benefits of virtual autopsy. Now coming to psychological autopsy, what do you understand by psychological autopsy? Nothing but a set of post-mortem investigation procedure, gathering all the relevant information from past life of victim of suicide. Usually, psychological autopsy is done in cases of suicide. Remember this. In your Viva voice, they might ask you, where do we do psychological autopsy? It is done in case of suicide. And here you try to find out, you try to talk to the kit and pain, their friends, the workplace, the colleagues, the parents, and the siblings, and you try to find out what was running in the patient's mind. You see what is running in the patient's mind. Therefore, it is called as a psychological autopsy. You derive various causes for the death of the person. It helps to ascertain and evaluate the role of physical and psychological factors that would have played caused the death of the person. So basically, you're trying to go deep into the mind of the person and analyze the situation and find out why the person would have committed suicide. It is done in cases of equivocal death. Do not indicate the manner of death involves conflicting data. So there are certain deaths in which even after you do an autopsy, you cut open the body and do an autopsy, you do not get to know the cause of death. It remains equivocal, maybe or may not be. You're in a dilemma. Okay? That is when you can do a psychological autopsy. You can talk to the patient and you can totally find out what is the cause of death. It involves collection of psychological data through deceased family members, friends, co-workers, and employees. So whom does the doctor talk to? They talk to the family members of the deceased person, friends, co-workers, as well as employees. You talk to all of these and gather enough data in order to understand what is running in the person's mind. So it significantly improves the manner of death determination. So basically, remember that both watchful autopsy as well as psychological autopsy will act as an add-on every time for the normal autopsy that we do, because it is going to give you certain perspectives, in-depth knowledge, or an additional knowledge in order to solve all the complex cases. That it gives you one more dimension towards the case. That is how it is going to help you. Okay. Next, we look into viscera preservation. How do you preserve the viscera in case of suspected poisoning? Remember that whenever there is a case of suspected poisoning, whenever you're doing autopsy, as a doctor, your role should also be to serve the to preserve the viscera. So, coming to viscera, what do you understand by viscera? Viscera is nothing but a soft tissue in the body. So, what kind of soft tissues are preserved? You preserve stomach, intestine, liver, kidney, blood, and urine. So, why do you have to preserve it? Because on these various chemical examinations can be done, and after you do the chemical examination, you can find out what is the cause of death. So it is sent to the forensic science laboratory where the chemical examination is done, and that is where it becomes important for you to preserve the organ whenever you suspect that a poisoning could be the cause of death. You have to preserve stomach along with its contents. That is, whatever the person has eaten, no, that will also have the poison. Or if the person has ingested the poison directly, it will be there in the stomach. So you have to preserve stomach with its contents. Upper part of small intestine has to be preserved. That is how much to be preserved. Around 30 centimeter length of small intestine has to be preserved. Liver has to be preserved. That is 0.5 kg of liver has to be preserved. That is how much? Half kg liver. One kidney has to be preserved. If you preserve one kidney, or you can take half of both the kidney. Okay, then also it counts to almost one. So you have to preserve blood. How much blood? 30 ml of blood. And from where do you take it? From a peripheral side. That is from a central site. You're not going to take central site, like for example, a femoral artery or a carotid artery. You're not going to puncture them and take blood. You will always take blood from a peripheral site. For example, a radial artery or a brachial artery. Peripheral site. Remember this. It's important for your MCQ. Urine has to be collected. How much urine? Around 30 ml urine has to be collected. From where do you collect? You put a catheter to the suprapubic region. So suprapubic catheterization has to be done and urine has to be collected. Why do we do suprapubic catheterization? Because any foul play or contamination won't happen. Because when you do a suprapubic puncture, ideally in a person who is living, the number of bacteria there is zero. Okay, so even if you get one bacteria in the suprapubic puncture, it says that the person has UTI. That much is the significance of a suprapubic puncture. So after a person dies, you do suprapubic puncture and collect urine. How much urine? You collect 30 ml of urine. How much blood? You collect 30 ml of blood. So tell me, what are the things to be preserved? Stomach with contents, intestine 30 centimeter, liver half kg, one kidney or half of each kidney, blood 30 ml and urine 30 ml. Got it? Now, what are the preservatives that are used? You can use saturated sodium chloride. What is sodium chloride? Nothing but NaCl. This NaCl is the most commonly used preservative. You can also use rectified spirit, and you can also use sodium or potassium fluoride. So these are the three things: sodium chloride, rectified spirit, and sodium or potassium fluoride. Apart from this, you have to follow certain instructions for the preservation and dispatch of viscera. So what are the instructions? The stomach and its contents are stored in one bottle, liver and kidney in another bottle, blood and urine separate. So how many containers do you totally need? 4. One is the stomach and its contents, because you do not want that contents to get mixed up with some other organ and all. Okay, so you preserve it separately. And then liver and kidney in another bottle, liver and kidney together in one bottle, urine separately, and blood separately. Okay. The quantity of preservative should be equal or more than the viscera. So, for example, if this is a container and whatever viscera that you have put is this much, the preservative that you add should also be towards this level. Okay, it should not be less than the level. It should be the same as how much you have taken the viscera or more than that. Only two-thirds of the capacity of the bottle should be filled. Just because there is space in the bottle, you do not tightly fill it. Okay. If you look at any of the specimen collection, you can see that only half is usually filled. If you have a bigger specimen, you can go up to two-thirds, but not more than two-thirds. Remember this. Okay, because whenever something is filled to the fullest, there are chances that there might be leakage and all. That's why you fill only to the two-thirds. And after you fill, stopper of the bottle should be well fitted so that there won't be any leakage. So these are the instructions to be followed. Apart from this, coming to the other instructions, name of the victim, autopsy number, organic contains, date and place should be mentioned. Because when the forensic laboratory person sees the content, he should be able to identify whose body this was collected from. And you'll also give him whatever the brief idea about whatever you found during autopsy so that it will aid in identifying the cause of death. You have to write all these details so that it is easier for the purpose of identification. If all these are not mentioned, the person will return you the sample. There won't be any use. The bottle should be put in the box, locked and sealed. So why you have to lock it and seal it? We can keep it in that one. No, it is because to avoid any foul play. Somebody might come and change the sample and all. No? So in order to prevent it, in order to prevent foul play, you have to lock and seal the box. A copy of the inquest report, postmortem report, authorization from magistrate should be sent to the laboratory. So whenever you're sending these viscera to the laboratory, along with it, you send the inquest report, postmortem report, as well as authorization. So these are the three letters that you send. So what are the three letters? Inquest. Inquest is the initial thing that demanded a autopsy. Postmortem report is whatever you find out during postmortem. And the authorization is from the magistrate. There should be authorization sent saying that you have to do so examination on all these viscera. So these three letters should go to the forensic science laboratory. Now let's discuss. As I told you, it's important for you to know about dissection of two organs. What are those organs? Heart and brain. Now let's look at the examination of heart and autopsy. Now coming to the examination of heart, you need to understand how do you. There is a method for dissecting heart. So what is that method called as? That method is nothing but the inflow-outflow method. So you have to remember this because in your Viva Musi, they'll ask you what is the method. Then you have to tell inflow-outflow method. So what do you understand by inflow-outflow method? That is, the atrium is opened first, the ventricle, following the direction of blood flow. So this is nothing but stating you about how you do the inflow. That is, first you open the atrium. So how does the blood comes to the atrium, goes to the ventricle, and then it is going to be pumped from the pulmonary artery to the other parts, or it is going to be pumped to the aorta to all the parts, to the pulmonary artery to the lungs. So this the process of entry of the blood is nothing from the atrium to ventricle. This is the inflow. And when you do this, valves are cut in between and not through the commissures. What do you understand? Let's look at through the image, okay? So they say that, so this is the atrium of the person, no? And this is the ventricle. They're saying that from the, so you can see the arrow here, no? Through the atrium, next we go to the ventricle and then we dissect it. And here, this is the right side of the heart. So from right side, where does the blood go to? The pulmonary artery. And in the center, you can see the valve, no? It is cut in the center. It should always cut in the center and not for commissures. When you cut to the commissure, that is from the base of it, it is going to damage the valves. So you cut it to the center. This is nothing but telling you about how an inflow is working. Next, right in the right side, the ventricular inflow tract is opened with a knife and scissor from the right atrium to the posterior tricuspid leaflet. That is, whenever you come to the valves, so these are the valves. As you can see in the image, this is nothing but the valve. Which are the valves that you can see in the image? No, this is nothing but the valve that is there here. And I'll mark with a green pen. Is saying that here in the right side, what is the name of the valve? It is nothing but the tricuspid valve. In the left, we have the mitral valve. So when you open, why is it called a tricuspid valve? It is because there are three leaflets. What are the three leaflets? You have the posterior leaflet, you have the anterior leaflet, and you have the central leaflet. So what when you do the right side, you have to always cut to the posterior leaflet. Okay, so how do you cut the tricuspid valve? Through the posterior leaflet. Next, now this is the inflow. Now you do the outflow tract. That is, outflow tract is opened in a similar fashion, approximately 1 centimeter from the anterior ventricular septum. So how do you do it? Let's go back to the image. So now inflow is the atrium and ventricle. Inside the heart is inflow. Outflow is blood going from the heart to outside. That is nothing but, now I'll be showing you through this red color arrow. Okay. So first we saw the inflow. What is inflow? Constituting of the atrium as well as ventricle. Now let's look at this black arrow. Now outflow is heart pumping out. So when heart pumps out, you can see, this is heart pumping out. This red arrow that I'm showing here. So here, so how do you cut it? So all this entire blood vessel, the pulmonary artery aorta, are closely adherent to the heart. So you make a cut 1 centimeter from the anterior ventricular septum. So this one that I'm showing in the blue arrow is the anterior ventricular septum. So 1 centimeter from that, you're going to make the outflow tract, cutting the aorta and the pulmonary trunk. So now whatever we discussed, from the atrium to the ventricle, and then we go to the pulmonary artery, this is nothing but in the right side. Similarly, so here atrium and ventricle is nothing but the inflow, and coming to the pulmonary artery is nothing but the outflow. Now coming to the left side of the heart, so what do you have there? You have atrium, you have ventricle, and then later you have aorta. So here, what is the inflow? Inflow is atrium and ventricle, and coming to aorta, it is nothing but the outflow. So similar fashion you do for left side also. Okay. Now coming to the procedure of removal of brain at autopsy. So as I told you, we need to know only about two organs, and one organ we saw it is nothing but heart. So what is the technique used? Inflow outflow technique. So now coming to the brain. So in brain, the cranial cavity is opened by using something called as a bimastoid incision. So what is bimastoid incision? So where is your mastoid process? Right behind your ear, no? Here, wherever I'm pointing from the arrow, this red color arrow, whatever is showing, this is nothing but a mastoid process. So bimastoid incision means from one mastoid to another mastoid, you make the incision. That is called as bimastoid. Then you hold the entire incision and reflect it. So you can see in the next image, no, this entire flap is reflected from the head. So this is called as bimastoid incision. So after you do this incision, you're going to remove the brain. How are you removing the brain? You have to cut the dura all along the line of cleavage of the skull, and then it is folded back to the midline. Free the falx cerebri from the cribriform plate, pull the dura and the falx backwards, then is exposed. So basically, as you can see in the image, you're going to tightly hold after you remove the skull cap, you're tightly going to hold the dura with your hands, and you're going to reflect it in such a way that it gets separated. And it gets separated from what? It gets separated from the falx cerebri and the cribriform plate, so that the entire it becomes free and you can remove the brain. So what do you have to examine? You have to examine the circle of Willis. You have to look for any saccular or very aneurysms that are there. So these aneurysms should be looked upon because the bursting of these could be the cause of death. So you have to look up for any saccular or very aneurysm. And the most common site of berry aneurysm is nothing but the junction between the anterior cerebral artery and the anterior communicating artery. So where is it? So if you look at the circle of Willis, you have this circle of Willis like this, and this is the anterior cerebral artery, and this is another anterior cerebral artery. In between both, you have something. This blue arrow is showing you the anterior communicating artery. So now in the black arrow, you can see the junction between the anterior communicating artery and the anterior cerebral artery is a place where commonly you can see a berry aneurysm. So you have to look at this point also whenever you're doing autopsy. Now coming to the last question, it is about exhumation. What do you understand by exhumation? Exhumation is nothing but the lethal digging out of an already buried body from the grave. That is, the person has died, and you take the body to the grave and you bury the person. Now, if you take back the buried body to do certain examination, then it is called as exhumation. In India, there is no time limit for exhumation. That is, after 2 years, you can do, after 3 years, you can do, after 5 years, you can do it at any time. There is no time limit in India. It can be done both in civil cases as well as criminal cases. Okay. Now, in criminal cases, for example, if it is a homicidal case, if it is a case of suspicious poisoning, death due to criminal abortion, or criminal negligence. So these are the cases where you could do a exhumation under the criminal case. Coming to civil case, that is accidental death claim, insurance, and inheritance claim. That is, whenever you have to claim for one of these things, all these come under the civil cases where you undertake exhumation. Now, coming to how you do it. Body is exhumed only with a written order from the executive magistrate. So, you have seen, no, whenever a magistrate requests order, he gives certain instructions only whenever there is a death because of police firing, death in police custody, death in the mental hospital, or dowry death. And one of the another reason where a magistrate inquest is done is in the case whenever there is exhumation involved. And here you need a written order from an executive magistrate in order to do exhumation. So what is the procedure of this? You have to identify grave, you have to identify the body. And how do you identify the grave of the person? You identify it based on the burial plot, headstone. So there will be that headstone, no, upon the person, where it will be mentioned, the name of the person and all will be mentioned. No? So you look at it and you identify the person. It should be conducted in natural light because we do not want to miss out any of the findings. So in order to prevent missing out any of the findings, we do it under natural light. And if there are a lot of spectators, that is so many people who are watching whatever you're doing, this entire thing should be screened off in order to avoid this thing from visualization by the spectators. So after removing dirt from the corpse, first what you do after you identify, open up, you remove the dirt, everything, you clean up the corpse, and after you clean up the corpse, you take a photo. So you take a photograph because this photograph will act as a physical proof to tell you about the position of how the body was found. In case of mineral poisoning, you collect half kg of soil from around the body. So why do you collect soil? Because this mineral could have got absorbed into the soil also. That's why you collect around half kg of soil. Body should be identified by the close relatives and friends. So these people should be there and they should help in identifying the body before you do the exhumation. And after you do the postmortem examination, disinfectants should not be sprayed in case of recent burial, normal postmortem, usual manner. Why shouldn't spray disinfectants? Because that will give you false clue about certain chemicals being the cause of death. If it's a putrefied body, what do you mean by putrefied body? That is a decomposed body. Then the identified body viscera should be uh, if it is a body that is being decomposed, then you have to identify the body. Viscera should be preserved for chemical analysis because a lot of things cannot be found out in normal post-mortem examination. That's why you have to take samples and do chemical analysis in the forensic laboratory so that you will get an idea about what could be the cause of death. So these were the important questions that we had to know in this topic. Now let's go back and see few of the MCQs. Okay. Now coming to MCQs. So there are a set of around 10 MCQs that we need to be knowing, okay? So I'll be launching the MCQs and we will look into the MCQs. Now coming to the first question. One of the main advantages of the virtual autopsy over a traditional autopsy is. So what did I tell you about a virtual autopsy? It is nothing but where you use CT and MRI to do an autopsy. And coming to traditional, cut open the body in order to find the cause of death. So what is the advantage here? Let's look into the options. It requires no consent from the deceased family. It provides a non-invasive method of examination. It is less expensive than traditional autopsy. Eliminates the need of any medical expertise. So what is the answer? The answer clearly is option B. Because you do CT and MRI, and these are non-invasive. And coming to the other options, for the virtual autopsy, also you need the consent of the family. That's why option A is out. It is less expensive. No, it is more expensive. As you know, CT and MRI is expensive. So it is going to be more expensive. So option C is also out. Coming to option D, it eliminates the need for any medical expertise. No, there should be a doctor who can read the CT and MRI. So doctor is necessary. Therefore, option D is also out. So what is the correct answer? Option D. It provides a non-invasive method of examination. Coming to the second question, what is the primary goal of dissecting the hearts during an autopsy? So let us see the options. Option A, to assess external injuries. Option B, to evaluate the coronary artery and valve. Option C, to collect tissue sample for genetic testing. Option D, to measure heart size and weight. What is the correct answer? Here also, the correct answer is option B, to evaluate the coronary artery and valves. Why? Because I told you we use the inflow-outflow technique where we cut the atrium and go to the ventricle, that is inflow, and through the center of the valve we're cutting. So we examine the valves, and also we are examining the arteries. We're examining the pulmonary artery, aorta, and all the other supporting artery. Therefore, option B is the correct answer. Coming to option A, to assess external injury, no. If we had to access the external injury, we don't have cut open the heart. No, so that is not the option. Option C, to collect tissue sample, no, we're not doing that. We are going to examine the valves and the coronary artery, and also to measure the heart size and weight. If you have to measure it, you wouldn't have dissected and cut open the heart. Coming to the third question, which incision is typically made to access the heart during an autopsy? What is the incision? This is a type of application type of question. I'm not told you. What is the answer? Let's see the option. Horizontal incision across the chest. Did we study about horizontal incision anywhere? No. So that is the wrong answer. Vertical incision along the left side, did we study about this incision? No. Circular incision around the heart? No. What is the only type of incision that we have studied? Y-shaped incision in the sternum. So this is a common sense type of question, okay? So basically, as we saw, there are three important incisions. What are those? I, Y, and U. Because only Y is given, that has to be the answer here. Okay? So this is a common sense type of question. What is the primary purpose of exhumation? To conduct a routine health check, to retrieve buried artifacts, to investigate cause of death, to relocate remains for burial. What is the answer? Option C, to investigate the cause of death, is the correct answer. Why? Because you're exhuming the body whenever you suspect that there could be some other cause of death. To find out the actual cause of death, you will do it. Okay, to retrieve some of the artifacts, for example, a gold chain or some valuables that are there and all, you do not want a magistrate's inquest in order to conduct all this. Okay, you can do it by yourself. Only to investigate the cause of death, you do this exhumation. Which legal requirement is often necessary before an exhumation can occur? So, what do you need? A letter from magistrate, or a public vote, a police report, or a medical examination? What do you need? Do you need a police report? No. Do you need a public vote? No. Do you need a magistrate's letter? Yes. Why do you need it? Because magistrate's letter is useful in certain cases where, for example, a death occurred in police custody, police firing, or a dowry death in mental hospitals, or for exhumation. These are the very few things that you have to know. It should be there in the tip of tongue where letter from magistrate is required. Exhumation is one such thing. Coming to the next question. In forensic investigations, exhumation is commonly performed when? Coming to the options, the body was buried in a public cemetery. There are suspicions of foul play or misdiagnosed death. The grave is unmarked. The burial site is at risk of flooding. So, where do you do? You do it whenever there is a foul play. So remember, always exhumation is done whenever it can be for criminal as well as civil case. Whenever you feel that the cause of death is something else or the cause of death is wrongly given, only then you do. Just because you have to shift the body or you have to find out some valuables from the body, or if the grave is going flooded or something, you do not do exhumation. Remember, the ultimate purpose of exhumation is in order to find out any foul play or any other wrong cause of death that was given and to ascertain the right cause of death. Okay. Now we'll go back to the second poll. Now let's look into some other questions. Okay. So what is the primary purpose of an autopsy? So what is the primary purpose of an autopsy? It is a single choice question. So number one option, to determine the cause of death, to provide legal evidence, to conduct medical research, to perform organ transplant. Why do you do an autopsy? This is what we discussed in the first statement of the chapter, no? To identify cause of death. So that is the correct answer. Coming to the next question, which type of autopsy is performed when death occurs under suspicious circumstances? So what is it called? Clinical autopsy, forensic autopsy, virtual autopsy, anatomical autopsy. What do? You do a forensic autopsy. What is the other name of forensic autopsy? It is nothing but medico-legal autopsy. Clinical autopsy is done in those cases where you have to find out what's the cause of death. Okay? And in those places where you suspect that there was a genetic problem that was there, or a family member could also have a similar problem, in such cases, after taking the permission from the family, you do a clinical autopsy. Okay? Virtual autopsy is done using CT or MRI. Anatomical autopsy is done in your dissection hall. So forensic autopsy, the medical legal autopsy is the right answer. What is the term for the external examination of the body during an autopsy? Histopathology, narcopsy, gross examination, toxicology. What is the correct answer? Gross examination. Whenever you externally see something, the physical findings, it is called as gross examination. Coming to the next question. The primary purpose of making a skin incision during an autopsy is to dash. Let's see the options. Remove clothing from the body, access internal organs during examination, preserve skin for forensic analysis, create a cosmetic appearance. So what is the answer? The answer is option B, access internal organs for examination. That is, you do a skin incision. What are the types of skin incision? You have I shape, you have Y shape, and U shape. You do this incision in order to open up the body and see the internal organs. So option B is the right answer. Coming to the last MCQ, what technology is primarily used in the virtual autopsy to examine the body? X-ray, MRI, CT, or ultrasound? This is also an important question. I told you that in virtual autopsy, you use both CT and MRI. But which is the most commonly used? Is it CT or MRI? It is going to be CT. Why CT? because CT is always more feasible, okay? It is more economical and you can get the results very fast. And also, there are no other constraints, okay? There are not many drawbacks, there are not many limitations of CT. So CT is always preferred over MRI. Got it? So these are the questions that you have to know. I hope you enjoyed the class. Thank you.